Hello, my name is Anne Marie, and I am a registered respiratory therapist. Today, I will be talking about asthma management for the caregiver. So, in this presentation, we'll be discussing what asthma is, how it is diagnosed, how it is treated, relationship between the patient and the caregiver, and how they can improve compliance. So to begin, what is asthma? Asthma is a treatable long-term airway disease, and it is caused by hypersensitivity within the lungs. Sometimes there can be mucus, and this tightens up the airways, and this makes it more difficult to breathe. So how is asthma diagnosed? Diagnosis of asthma is pretty simple. A patient might come in and say that their child is frequently coughing, that they have triggers when they go outside or they're exercising, they get short of breath. So when patients come in and say that they get short of breath during the night or during the daytime and they're coughing a lot and they have a wheezing sound, that's when your ears can perk up and consider maybe they have asthma. So what are the common triggers of asthma? Sometimes dust and particles can get in the lungs and irritate the airways. Pollen can also have an effect on the lungs, as well as cigarette smoking and the changes in the season. So sometimes when the fall changes to the spring or the spring changes to the summer, that extra pollen in the air can cause an asthma exacerbation. So in order to stay out of the emergency room, it's very important to reduce triggers when you are able to. So to reduce asthma exacerbations, you want to avoid triggers, you want to take medication as prescribed, you want to use a spacer device to deliver the medication effectively in the lungs, and you want to prepare for exercise. Either take a albuterol inhaler before exercise so that you won't get an asthma exacerbation. And also, attending quarterly asthma rechecks is a great way to stay on top of asthma symptoms so that they can be treated before it becomes an emergency. So, there are some common treatments for asthma. It's a treatable disease. There are medications such as albuterol, Atrovent, Duoneb, which is albuterol and Atrovent together. And then there are long-term medications, Advair and Flovent. Those have steroids in them, and it's also important to let the patient know that they need to wash out their mouth after taking a steroid, or else they can get thrush, a fungal disease on their tongue, and we don't want that. And when suggesting medication tips, you want to keep in mind that they need to use a spacer and they need to take medication as prescribed. So here are what some of the medication for asthma looks like. There is albuterol, there's Advair, there's Flovent, and then there's a spacer to take with your inhaler. So if there is an emergency in the office, there are certain tools you can use to improve a patient's symptoms. First, you need a nebulizer cup, a mask or a mouthpiece, the medication, and the gas source. And if their oxygen is below 90%, you can give them an oxygen mask and put the oxygen flow meter to at least 8 to 10 liters per minute. So if a patient asks how to use a spacer, you can tell them that There are instructions inside the NDI inhaler packet, and there are also instructions on the chamber. But just briefly, first, before you take the inhaler, you have to shake the inhaler at least 5 times vigorously to get all the medication mixed up. And then if it's the first time using the inhaler, or if it's been 7 days without use, you need to prime the inhaler, and that's spraying the inhaler away from your face. And then once you've done that, you insert the inhaler into the spacer, and you take off the dust cover and you put it right where the inhaler needs to go in the rubber portion of the spacer. And you put your mouth on the mouthpiece and take a deep breath in while you press the canister. So for patient compliance with asthma rechecks for Ivy League Pediatric Office, we really want to encourage taking asthma rechecks and scheduling them at least 4 times. Sometimes patients can say that they don't have enough time, or that they forget their appointment altogether, or they just don't think it's a priority. And when they say that, you can say that it's very important to have asthma rechecks so that you can prevent an asthma emergency in the future. So if an asthma emergency happens, there are some things you can look out for. So in an asthma emergency response, if the child is in distress, and how you describe that, the child is bending over, they're holding their chest, and they have the prominent jugular veins in their neck are popping out, so that the child is in distress, they are having trouble breathing. And they also can have audible wheezing that sounds like a whistling sound. In addition, they can't speak without catching their breath. They can only say about 2 to 3 words between breaths. And if they have blue lips or blue fingertips, that means that they need oxygen immediately. So here is a little card that will be given to the staff so that they can remember how to look out and how to assess for someone who's having an asthma attack. When in the office, it's very important after appointments and during phone calls to encourage asthma recheck visits. Explaining the importance of staying up to date with asthma rechecks is very important, and especially during the weather changes that happen throughout the season. That's when most asthma flare-ups come about. So it's very great to encourage asthma rechecks during these times and other times as well. So if someone is having an asthma attack and they come to the office and you see that they're in distress, they're audibly breathing, they can't catch their breath, or they have blue lips or fingertips, you want to notify the office immediately. Notify the office so that they can help this patient. Also want to gather the supplies that they need So thank you so